Hey, I'm Brian Williams, AMSSM's Director of Policy and Advocacy. I'm here at the AMSSM Annual Meeting in Austin, Texas, meeting with a lot of our members, including AMSSM members who are serving as state legislative key contacts. If you didn't already know, AMSSM state key contacts help identify and review and advocate for, or sometimes we advocate against, relevant legislation that impacts sports medicine. Issues like scope of practice, definitions, and state concussion policies and other sports medicine policies. During the annual meeting, it's really been a great pleasure to meet with several of AMSSM's key contacts. Hey, I've got AK Misra and Cindy Chang here from California. They're both state key contacts from the state of California. What's going on in California?
Well, we need some help with ATC licensure. It's a challenge. The COVID-19 pandemic, unfortunately, was a force multiplier in driving more ATCs out of the state. As it was, we already had this challenge, so it's further exacerbated our point of care challenges that we face in our state.
Yeah, that's pretty amazing. So.
Yeah, one of the things I think that is also driving them out of the state is the fact that there's not a lot of respect for ATs in the state of California, because we're the only state in the country that don't have licensure or regulation, which means that anyone can come into our state and claim that they're an athletic trainer, provide care for our youth athletes and other exercising individuals, and we don't think that says a lot about how we respect what the athletic trainers do. So in order to provide health and safety, the best health and safety for our youth athletes, in order to make sure that they receive the best care, we need to get athletic trainers licensed, regulated in our state. So that's really a core mission of ours in this upcoming year.
Hey, I'm here with Dawn Mattern from North Dakota. She's one of our state key contacts. We really appreciate all of her work. What's going on in North Dakota, Dawn?
Well, right now we're getting ready for a snowstorm, so not much is going on in North Dakota right now. But I've been able to reach out to Brian and the advocacy group for help with some bills in North Dakota, because there's only about 10 of us sports docs there. So I kind of am on an island and you're my lifeboat. So we were able to connect and be able to take care of some physical bills, some bills pertaining to sports physicals, where they were looking at increasing the scope of the chiropractors and things like that. And yes, we are a small state, but chiropractors don't have to help us with that. So we were able to kind of talk them down from that and explain a little bit more of what we want out of sports physicals, and we were able to defeat that bill and make sure that we ensure that our kids are safe.
That's great work. Appreciate all your work, Dawn.
Thanks.
Hey, I'm here with Anthony Shadiack from South Carolina. He's one of our state key contacts. What's going on in South Carolina?
At my local hospital at Grand Strand Hospital in Myrtle Beach, South Carolina, we've developed a youth concussion program at our local hospital just to improve the concussion care that we provide our patients. And meeting with one of the other co-chairs, we had some longer planned goals, one of which was improving the laws that surround concussion care within South Carolina. And so to that end, we've been meeting as part of the Brain Injury Association of South Carolina and Brain Injury Safety Net Task Force. And with our local concussion program, we've been meeting with a state legislative contact, Mr. Case Britton, one of the Republican House of Representatives from Horry County, in trying to improve some different laws that we have for it. And basically what we've done is just taken a look at what already exists in other states and trying to get us up to muster with everybody else. We're really looking forward to working with Mr. Williams as well as AMSSM and helping push forward concussion care in South Carolina.
Hey, I'm here with Jason Matuszak. He's the state key contact for New York. Hey, Jason, what's going on in New York?
Brian, we've got a lot of stuff going on in New York. We're really excited about, number one, we've got this program that we're supporting where we are trying to make sure people who have physical disadvantages are still able to access the state parks, and really kind of working with organizations to make sure that they have that type of access. We've got this community outreach type of thing. But we've also identified a couple of key legislative priorities that we want to work on, and some trouble that some of our members are having with insurance company things. Take for instance, we're seeing an uptick in the requirement for authorization in order to do ultrasound guided procedures. And we've targeted that as being something that we think we should support efforts to write letters or things like that to address with the insurance companies. And we've seen a change in the payments with things like viscosupplementations again, where a number of the payers have shifted back away from authorizing viscosupplementation injections where they had been before. So these are the types of things that we try to work on for our members and making sure that we're hearing from them them, outreaching into the community to make sure we have these community advocacy efforts, and we want to support our members where they are.
That's cool. Appreciate all the work you're doing in New York. And if you're having similar issues in your state, please reach out anytime. Thanks,
All right.
Jason.
Thanks, Brian.
So I just want to say thank you to all of our state key contacts who help make AMSSM's advocacy efforts so effective. And let me just invite any of you who have an interest in public policy and want to get more involved in AMSSM's advocacy efforts, please reach out to me, especially if you're from Idaho, Oklahoma, or Alaska. Give me a call. We need your help in those states. Hey, thanks for all you do.